Lovely. Hello everybody, my name is Ella. I am the nursing director here at Future Frontlines, and we are all very excited to bring you this first nursing webinar for this academic year, exploring the 4 fields of nursing. Thank you so much for joining us. Just before we start, just a few reminders if that's okay. Please ensure that you keep your microphones on mute and your cameras off at all times. We might ask you to unmute them at certain times, but while we're talking, it would be great if you can just keep them off for now. Please save all of your questions till the end. We will be asking you to use the chat box function later on, but for now, please save them till the end. Please make sure you also fill out the feedback form at the end to receive your certificate. That's really beneficial for us, and it will also give you a good resource going forward. So that's great. Just a disclaimer as well, just to say, no information shared during webinars should be used as a resource, guideline or reference for clinical practice or decision making, or by any patient looking for information and advice. That's just very important to bear in mind. Again, before we start, just a little bit more on Future Frontlines. Future Frontline is a not-for-profit organisation. It is free now and it always will be. It was founded in August 2020 and is run by current UK healthcare students and professionals. It has the aim of inspiring and supporting young people into a career in the NHS. It also supports interprofessional education and hopes to use teamwork and collaborative practice to develop all of the NHS worker skills. We run monthly multidisciplinary team webinars, so if that's something you're interested in, then definitely get involved with those too. And then a reminder that we are on all sorts of social media, as the next few slides will show. This is our website, and you can find all of our blogs, articles, and upcoming events. So it's definitely one to check out. These are some of the specialities that we cover. We've got dentistry, dietetics, nutrition, paramedicine. So sort of all of the things you can think of, all of the careers are all there for you to go and explore in your own time. We're on Instagram, Twitter. This webinar will be uploaded onto YouTube. So if you want to share it with your peers or you want to return back to it, then you can always access it there. We also have a podcast, which you'll find in the usual place that you access all of your podcasts, and a link to our website, as I've just said. We'd love, if you enjoy this webinar, for you to take a picture and share the event. Tag us in your Instagram stories and tweet us and use the hashtag #FutureFrontlineNurseWebinar. So moving on now, the learning objectives we have for today. We'd like you to understand the 4 fields of nursing and what each of these offers as an educational pathway, and to explore how each of the 4 fields differ, evaluating the advantages and disadvantages. So as I said, my name is Ella and I am the adult nurse co-host today. I am the nursing director at Future Frontline. And I'm passionate about environmental sustainability within healthcare. And I'd like to introduce to you, they will all say a little bit about themselves, my wonderful colleagues who are joining me today.
Yeah, so I'm Neve. I'm about to go into my 2nd year of mental health nursing at Keele. I spend half my life at work or placement and the other half at the gym or with friends, and making sure I have a good balance, and doing a lot of volunteering.
I'm Freya. I'm a children's nursing student and nursing officer for Future Frontline. I love children's nursing, and I'll be sharing with you a bit about what that entails later on today. Really interested in paediatric intensive care and showing people, young people, that are disabled or have chronic health conditions or mental health conditions, that they can also have a career in healthcare. So I do some like advocacy alongside my degree. Yeah, that's me.
Hi, I'm Fleur. I am a final year learning disability nursing student, and I was 7 shifts away from qualifying, but I moved my shift from yesterday to today. from tomorrow to today. So I'm actually 6 shifts away from qualifying now. And I'm hoping, similar to what Freya's just said, kind of show that people with disabilities have a place of working in the NHS. Because I have a little walking stick, which you might be able to see in the picture. And I'm hoping that in about 3 years' time or so, I'll be in a position to go to Australia and work as a nurse there and volunteer for the 2026 Commonwealth Games, because I've just finished volunteering for the 2022 Commonwealth Games that are held in Birmingham. And I think it'll be a really interesting time because Australia is finally starting to open up to this idea that people with learning disabilities need their own sort of specialised care rather than just generic care. So it'll be interesting to see what happens.
Thank you ever so much. That's great. So as is probably quite obvious just from our biographies there are 4 fields of nursing that we'll be exploring today. These are adult nursing, learning disability nursing, mental health nursing, and paediatric nursing. I'm going to start by exploring adult nursing with you a little bit. So as an overview, adult nursing is probably the type of nursing that first comes to your mind when thinking about nurses more generally. It covers the care of adults of all ages from 18 years and above who suffer from both long and short-term illnesses and diseases within a variety of contexts across the NHS. All nurses, but in particular adult nurses, support these patients by assessing their needs, preventing deterioration, aiding them with the activities of daily living where necessary, and assisting them back to health. That's quite a broad sort of generalization of what nurses do sort of across the 4 fields. But adult nursing obviously is very broad and just sort of focuses on that age range, 18 years and above. So what are some of the advantages of adult nursing? When I was thinking about this, I think we all found there's a lot of crossover. There are advantages of all fields of nursing that are very similar. Personally, I feel all fields of nursing are very highly rewarding, and in all of them you meet a huge variety of individuals, both patients and colleagues. Slightly more particular to adult nursing is perhaps the variety of patients at varying stages of life. You could have on a ward an 18-year-old next to a 100-year-old. So these people all have great variety of life experience, and it's a real sort of privilege to be able to nurse people in different stages of their lives. Again, one of the huge advantages of all nursing is the scope for future opportunities, development, specialisation, and sort of different professionalisms that you can go into. It's incredibly broad, and I think one of my colleagues later will go on that perhaps it's a misconception with some other fields, but I think it's applicable to all fields. At some universities, it is possible to transfer to another field after the first year. So you could do the first year as an adult nurse, particularly if you were unsure. Adult nursing is probably a good place to start. And then maybe over the summer, you think, oh, actually, I'd like to do paediatric nursing. At some universities, you would then be able, after 1 year of adult nursing, to go and choose a different speciality. So that might be something to bear in mind if you're a little bit unsure as to where you'd like to go. Adult nursing, being probably the broadest with the broadest age range, has a lot of resources, academic, non-academic. There's a lot out there that you can read and look up on. So if you are unsure, definitely go and scout around a bit. I asked all of my colleagues to think about the disadvantages of nursing in the hope that it wouldn't put everybody off, because I know there's a lot of noise out there at the moment about healthcare, but I think it's really important to think about. So when thinking about adult nursing, I was thinking about the aging population that we have. A lot of care of the elderly is involved in adult nursing for obvious reasons. This can be incredibly rewarding. However, I think it is important to bear in mind that this can be distressing. And although sort of death and loss is apparent in, again, all of the fields of nursing, I think particularly in adult nursing, you see a lot of care of the elderly, and inevitably you'll probably see quite a lot of loss, which is distressing and unfortunate, but it is sort of the circle of life, and as nurses you are there to support those people in these things. That's definitely something to bear in mind before you start on this career. Also, something that maybe people don't think of is about how adult nursing might be quite physically demanding. this can be said of mental health nursing and learning disability, and to some extent paediatric nursing, because all people of all ages come in different sizes, and some of them are immobile or struggle with their mobility, and it is important that we encourage them to be mobile or reposition them to ensure that they have good skin integrity. For you can imagine that, you know, repositioning a baby is probably not that physically demanding, but repositioning somebody who's slightly larger than that sometimes can be quite physically demanding. So I think that's something that's quite specific to adult nursing. That's something that people don't necessarily think about when they first go into the career. I wanted to give an overview next of what university might like. I'd like to hope that many of you here today are aspiring healthcare students. So I think it's always great to have an idea about what university might look like. Some of the common modules in adult nursing, once again, are applicable to all of the fields. Things like anatomy, fundamentals, your episodes of care, so your practical skills, caring for patients with complex or multiple needs, and your assessment and decision making is very much something that all nurses do. But of course, anatomy would be very specific to 18 years and above. Again, with pharmacology, any drug dosing will be very specific to 18 years and above. And I'm sure Freya will be able to tell us more about how that might vary a little later. Oh, we seem to have skipped a few slides a second. Thank you. And then again, placement areas for all fields, there's a lot of overlap, but I'm hoping that today will give people a lovely sort of overview of nursing in general, not just the different fields. So we have general medicine, general surgery, and then we might think about what more emergency medicine, more high dependency, your sort of intensive care units. There are your specialized services, things like cardiology, oncology, hematology. But thinking maybe outside of that hospital setting, your GP practices, your care homes, your sexual health clinics, and some that people don't think of, like prisons and that sort of thing. And finally, again, all nursing has a huge, broad scope for careers. And I think personally, that's one of the reasons that I decided to go into nursing in the first place. It's just the expanse of things you can do with it. I've listed a few examples below, but this is by no means an exhaustive list of potential careers for adult nurses. You could be an emergency care nurse, working in ED, in majors, in resus. You could be a practice nurse, looking after patients with chronic conditions in the community on more of an appointment basis. You can be a district nurse, that involves going to visit patients who are homebound. They might not necessarily be acutely well, but they might need some regular intervention, like dressings or injections, and district nurses will go into patients' home to see them there. You have nurse specialists in hospital settings. So we have tissue viability nurses, cardiac nurses, things that might need more support in a hospital setting. You can have people who specialize in those areas to support the rest of the hospital. You could go into research as a nurse. You could work in education, university lecturing, but also improving hospital education, improving the running of hospitals, and then also into management. So I think that's everything from me for the moment. I'd love to pass you over to Fleur.
So hi again, it's me, I'm back again. So learning disability nursing is probably one of the least understood fields of nursing. I know for a fact that when I was applying for my nursing degree, I didn't know it was a thing. I can remember I was 17, I was about to submit my UCAS application, and then I got an email saying, oh yeah, you've been selected to be a main campaigns champion. And I was like, oh yeah, I completely forgot about that. And this was just before the Treat Me Well campaign came out in February of 2018. So that's all about getting better healthcare for people with learning disabilities. And it all starts with learning disability nurses. Hence why I changed all my options. I was like, I'm doing that because that makes more sense for me to do that right now. One of the really unique and to an extent challenging things about learning disability nursing is that you get to work with people from the cradle to the grave, because whilst people have to be under 18 to be diagnosed with a learning disability, they don't just stop having a learning disability once they turn 18. You'll be working with people that are like maybe 3, 4, 5 years old, and up until late 80s, like early 90s. I think the oldest person I worked with was about 104. I didn't believe her until she started showing me really, really old pictures, and I was like, okay, no, you're definitely 104. And that's something that I was really, really drawn to as well, because of it's got that such age range that I could have experience working with all the different stages of life where people have got all sorts of different complex health needs and complex social care needs. And yeah, that's just something that's really, really special about learning disability nursing, I think. Can we go to the next slide, please? So yeah, just like what I've said, that's one of the biggest advantages for me personally, is that you have the chances to work with all these different age groups. Some patients you'll work with, they might just have autism, and autism isn't a learning disability, just a disclaimer. It gets bundled together in quite a lot, but they're two very different ends of healthcare. And you might just work with someone, a young child that's got autism, they're having social issues at school, and you're just there to sort of support them and provide the school with resources on how they can best support that individual. But then on the flip side of things, you're working with a wheelchair user who is unable to feed, wash, or dress themselves. They have peg feeds every 2 hours. They need to have their pads changed every 3 hours minimum. And then they've got really high risk of chest infection, so you've got to be monitoring all of these other vital signs. So it isn't just a case of, it really gets misconstrued as like being just heavily social care based, but it's really not. There's lots of clinical and complex skills involved with it as well. And again, that is something that I really, really like. It's that with learning disability nursing, there's a real person-centered approach. And you'll hear that a lot probably throughout the course of your studies as well. Because every person with a learning disability is unique. There is literally no two people that have the same diagnosis, they're the same age, same gender, they have all the same social factors, but they will distinctly be very, very different in how their care needs to be approached. And that can sometimes be forgotten about in more acute settings, just from personal experience. And you have to be creative with these things, because there are sometimes patients will just be very, very in their own heads, and because they struggle to communicate, they get frustrated and they can't say, oh, I want to go and do this, or can you leave me alone please, I need my space. So it's a case of having to think, okay, how can we put something in place to help them tell us what they need? And that's something that I personally really enjoy doing. On the flip side of all of that positivity, one of the major disadvantages that I've found throughout my entire time as a student learning disability nurse is the stigmatization that we face, because people often assume that learning disability nursing isn't real nursing because of what it has been previously, and things like the scandals that have come out around the care for people with learning disabilities. None of that really helps the image that we had basically spent working on for like the past 100 years, because learning disability nursing has only really been a thing since 1919. That's when it officially became recognised as a separate field of nursing. And it's been unpleasant to be out on placements and people say to you, why are you here? This isn't a learning disability setting. And then I have to be like, well, no, it's a dementia-friendly rehabilitation unit, and lots of presentations of people with dementia overlap with how people present when they have learning disabilities. And then they actually sit there and think, and they're like, oh yeah, that makes a lot of sense. And one thing that I've definitely struggled with while being a student is the limited field-specific contemporary research that's available. Because adult nursing gets loads of funding, mental health nursing gets loads of funding when it comes to research, even same with children. Learning disability nursing related research, no one really cares, which is why I'm really driven to try and get into research at some point in my career. And it's a challenge, but it's something that you can actually sort of fall back on when you're being asked to write assignments and essays and discussion papers as to why the articles you're using are like over 5 years old. You can just say, because there's not enough research out there, and I completely disagree with that sentiment. that's a handy little tidbit to keep for later. Can we go to the next slide, please? So I took a really different approach to this slide than what Ella did, because my university had 2 years of generalized education. We'd have more specific placements, but they were still slightly more, anyone could really go to those placements. So everyone had the same modules every year. So we had a module on leadership, module on care, complex care, and then global health. I always love the global health modules because that's when we'd like get really into like the sciencey side of like really poor timing, epidemics and diseases. And literally we had just finished that module when we were sent off of placement from COVID. So that was really great timing. Thanks, universe. But then in our final year, our modules were way more specific. So they still had the same general themes, but they were really focused on a learning disability nursing approach. I can't think of an example off the top of my head, which is really bad because I've just finished my academic year. But like we had sessions on, we had like an epilepsy nurse come in and talk to us about her role working with people with learning disabilities who have epilepsy. And that was really fascinating. And she told us more about the various types of epilepsy and approaches of care and all sorts of stuff. Really fascinating. Placement areas, so varied. It's like my favorite part of my degree. I'm pretty sure that's probably everyone's favorite part of their nursing degree is the placement side of it. And you've got, so these are just some of the ones that I've done. So I had a placement in neurology, neurosurgery, which was in like the big hospital with all the other adult nurses. It was very strange. I was the only LD nurse on the unit. Older adult rehabilitation, end of life care, palliative care. They are two different things. Learning disability, child, adolescent, mental health services based in the community. So that's going into people's homes, their schools, so on. Then you've got community learning disability nursing, which is kind of similar to the LD CAMS, but it has a more health needs approach rather than a mental health needs approach. Enhanced care service is a kind of just like doing assessments and making sure that people have got the appropriate support that they need. They're having their healthcare needs met, their social care needs met, all sorts of stuff. Intensive support teams is when you'll have like a learning disability, it's like a group of learning disability nurses that go and provide support to patients in their homes with their families. And that can literally be for any age group, from children's to adults. And you can also get learning disability CAMS as an inpatient. So that's actually where my job's going to be based. I'm going to work with children and young people with autism and learning disabilities in a mental health hospital on the eating disorders unit. And that just sort of shows you how specialized it can get. I didn't even know that was a job until I applied for it. I was like, that is where I want to work. So yeah, I think that's all of my stuff, unless there's one more slide for me. There is one more slide. Careers, here we go. Just basically same as what I was saying for the placement areas. Behaviour nurses. So my best friend has just started her job as a behaviour nurse. She works in the community. She goes and supports people with learning disabilities, whether they're at home, respite or residential. Then you've got the CAMS community LD nurse, like I mentioned, inpatient, learning disability liaison nurses. So you might, they have like two different titles for the similar sort of jobs. So you've got the liaison nurse and the health facilitation nurse. Health facilitation tends to be more community based, but liaison nurses tend to be based in hospitals. And that is like my dream job, because it's a really good mix of working as like a sort of lone worker, but also going to visit patients on the ward, making sure positive behaviour support plans are in place, that the staff around that are caring for this individual are aware of their additional needs and all that sort of stuff. It's like really high intensity job, but really, really, really satisfying at the end of it all. You've got nutrition nurses. So nutrition nurses is also something that you might see in pretty much any field of nursing, really. So that'd be people caring for people that have got like PEGs. Oh, can't remember the word for it now. Enteral gastronomy, something. Basically, it's a tube that goes into the stomach and people get fed through the tube.
Cutaneous endoscopic gastrostomy.
Thank you. I could not remember the word for it. I was looking, I had my PEG refresher training the other day, and it's just gone poof. Then you've got your nasogastronomy tube, all different tubes to help people get their nutritional needs met. Then you've got respite care service nurse for adults or children, residential care service nurse for adults or children, obviously with learning disabilities as well. And there are genuinely so many opportunities. And one thing that I think is really interesting about learning disability nurses now is that we're finally having a bit more of a chance to prove ourselves and in regards to our skills, because of the way that the future nurse courses have been completely put on their heads and in regarding skills. So I know that the Children's Hospital, which is literally like down the road from me, is currently starting to offer, I think it's about 3 or 4 placements, like placement spots to learn disability nurses on top of all the placements they provide for children's nurses. So endless opportunities. And I think that's me done. Yeah.
Yeah, so mental health nursing, I think it gets a very varied rep. I think some people don't like it. Some people are like, yes. I think there's been a lot of bad press around it, which is probably because of the systems that are in place, and it's probably not progressed and adapted quite as quick as it should have. But it's incredibly wide. So it covers a huge range of conditions, from like perinatal mental health, so your postpartum psychosis, postpartum depression after having children, to dementia. A huge amount of dementia care comes under mental health services, not physical health. So the assessments, so your memory clinics, which assess for dementia, come under mental health. Your dementia primary care nurses tend to be mental health, which help people manage their symptoms of dementia in the community. You can get specialist dementia inpatient units in mental health hospitals. And I think that's one that's often not thought of as mental health, but actually in terms of the symptoms and presentation, it very much falls within mental health. And then you've also got your eating disorders, your personality disorders, your anxiety, depression, PTSD, everything, all the different conditions that you have. And then you've also got all your different teams. So you have your inpatient teams, you have your community teams, you have your A&E based teams. It's such a varied field, and it's all about helping people to be able to live their best life. So with mental health, it's not always a straight fix. Quite often it is putting systems in place to try and get people a better quality of life, or to maintain their own mental health, and actually giving them the tools to be able to maintain it, and potentially support throughout from community teams and medication. It's so varied. Now, some of the advantages that I really like is it lets you get to know your patient. So one of the main things in mental health for someone to successfully work with an individual is the relationship that you build with them. It's not, here's your standard treatment plan. It's, okay, what is this person? What are they struggling with? What are they succeeding with? What is holding them back? What tools can we use to help them be able to manage it? How can we help them live their best life? And for some people, that's complete recovery. For some people, that's living with their mental health and managing it. For some people, that's more intensive support that can go on for a really long time. But also, because so much of our services are based in communities and we try to avoid hospital at all costs, it means that you get to see a lot longer of someone's progress and their story. And I really like that. So one of the main disadvantages that I find is that because of the way mental health services are constrained, and what services do what, and the criteria to get into them, which quite often comes down to funding, it sometimes means that you can't support people the way that you would want to support that individual. That sometimes you see someone and you're like, they could do with this, however, they don't quite meet what would be needed to classify them to get that. And that can be really hard, knowing that someone could benefit from it, but because they're not at that stage where it's having so much of an impact on their life, they won't be eligible for it. And on top of that, it can sometimes be really hard on your own mental health to constantly be talking to others, hearing stories. You don't tend to see people on their best days quite a lot of the time with mental health. There's a historic problem, like historic events and difficulties, and it's not a fresh out of nowhere. Sometimes it is. Quite often with perinatal, it can just be a first time event and it can literally be the hormones from pregnancy. But quite often with a lot of conditions, there's a history, and sometimes hearing people talk about them can be quite difficult for yourself, and you have to be able to put them strategies in place to manage your own mental health and also your opinions, because you won't necessarily agree with what everyone thinks or does or how they manage it. But if that makes them healthy and they're also safe, then that's great. That's actually what you aim for. I think as well as that, it can sometimes be difficult when you can see that someone needs some support, but they have no insight into their own mental health. Because quite a lot of the times, especially in mental health, when people get really like poor mental health, they don't necessarily notice. So it can happen quite often in psychosis, where they'll be seeing things and hearing it, but because they believe it's real, they don't realize that that's a hallucination. And that can actually be really difficult when you're talking to people and they don't have that insight, because you want to help them, but they don't realize that there's anything going on, because to them that is reality, that is their normal. And I think that takes a lot on your own mental health as well, because you can see this person deteriorating without help until they hit a point where it can be managed in the community, or they'll suddenly realize, but it usually means that you can't help them as early on as you want to. Now, in terms of modules, I at my university found that we do the exact same modules as the other courses for all 3 years. We do 6 across the 3 years, so it's 2 a year clinical nursing modules, which are where all our placements and all our skills sit. Obviously, the skills are quite often the same. You might have a bit more specialty in certain areas, but in terms of like depots, IVs, injections, bloods, catheterization, dressings, you still learn all them skills, and they can be really, really useful. That sits within our clinical nursing modules. In terms of our other modules, our week was always 2 days one module, 2 days the other modules, and our 2 days on our other modules aren't our clinical skills, would be 1 day general. So we did person-centered care, so it's how you treat and make sure a person that's centered their care. And then our second module was fundamentals of nursing, so that covered pretty much everything, all the basics. It covered our anatomy and physiology and our basics. I know next year we have pharmaceuticals, and I don't know if it changed. I think we get slightly less, but we still get similar, but we get 1 day a week field. So in our non-clinical modules, we do our general day and then we do our field day. And on our field day, we do entire day-long workshops. So we do depression workshops, anxiety workshops, CBT workshops, psychosis, suicide, mental health first aid. We do all the workshops and we go quite deep into them subjects. Now, I do know on our general days, we sometimes did a very base layer on quite a few of them, such as suicide, and we did a generalized anxiety and depression one in our general, so that all fields of nursing have that awareness. And then we go into a lot more depth in how to actually manage them conditions in our field days. Now, in terms of placement, it is hugely varied. We have inpatient and community. For mental health, more than I believe adult and child get, I think it might be similar to learning disability, we get a lot more community placements because so much of our services are based in the community and there's not as much hospital services. We do get, I've had 2 community-based placements, 2 inpatient placements, and across the 3 years, it will probably work out roughly the same because there's so many community teams that specialise. You also have your forensic placements, so within secure mental health services for people who may have committed a crime but have been suffering from a mental health condition at that point and have actually maybe not had the capacity to understand what they were doing, and then they're there for mental health treatment. And you have your crisis and liaison teams that are based out of like I know there's a specialist crisis care centre where I am, and then our liaison team's actually based at A&E, and it covers, our liaison team is similar to the learning disability liaison team. It covers the entire hospital, and they can go if there's any mental health cases. But our crisis care centre is a separate, it's at the mental health hospital, not the physical health hospital near us. And then the other thing as well about placements is, from talking a lot more with adult nurses, is you might not necessarily always be following an assigned nurse. In the community, you quite often will. In a ward, you'll quite often be given tasks or just generally just talk to the patients, because so much about it is about talking and building relationships. So you won't just be following someone around. You'll be in the ward on your own. You'll obviously have like safety briefings. Most mental health inpatient wards, pretty much all, actually, I don't know a single one that doesn't, has something that like some sort of alarm system. And usually if you're on a mental health ward, you have one, or you have to be in sight of someone if you don't have it on you. And it does give you a huge level of safety, but you're not always directly with your nurse. So it's about building them conversations and also being confident enough to ask your nurse, like, hey, actually, I need to do this. Hey, actually, can I observe you doing meds? To get them skills as well. In terms of career, it's hugely varied. Like I said before, a lot of even inpatient and community teams specialise in separate mental health conditions. So you quite often find there's teams with different names that actually do very, very similar jobs, but for different specialties. So you have quite, where I am, you have an early intervention team that specialises in psychosis, but then you have like outreach, and then you have assessment and stabilisation in the community teams, and they do similar jobs, but they tend to specialise in different conditions. You also have your inpatients the same, they different wards specialise in different things. You tend to have your CAMS services, then 18 to 64, and then 65 and above services are separate, but you can work across the whole range. And then you also have more so specialist mental health nurses are starting to be working across GP surgeries. Quite often when they're employed by GP surgery, it might be like 3 or 4 GP surgeries all go, yes, we'll employ them, and they do like a day at each to support with mental health. You also have your rehab, which is drug and alcohol services, that falls under mental health, but there's also many other forms of rehab. If someone's been in and out of mental health hospitals since they were 14, 15, 16, quite often they won't have them basic skills to be able to just live in the community. So you can get mental health rehabs that work on managing that, and also teaching them how to like manage their medication themselves, do the basic daily tasks, how to be able to succeed. And that's also where nurses are based. And I think that's all the roles I can think of really at the minute.
Okay, so with paediatric nursing, essentially it is looking after people from neonates, so premature babies that can be born. I think recently, normally the survival rate for premature babies is 24 weeks. At 24 weeks, it is considered viable, but recently, due to wonderful modern medicine, we can be caring for children outside of the womb from 21 weeks, and they can survive with minimal to no health complications. So right from 21 weeks, when they may have been born premature, up until 18, and sometimes with our long-term patients, we'll be treating them up until 21 as well, but that's on sort of an individual level. Children's nursing can take place in the community, in district general hospitals, where you may have one general peds ward within a typical adult hospital. And then we've also got specialist children's hospitals around the country. There, off the top of my head, there's 5 or 6, but I'm sure there's probably more. But in comparison to general hospitals, there is much fewer. You tend to have, children tend to be, unless they live near a paediatric hospital, they'll be treated in a district general, and then if they need more acute care, they'll be transferred by an ambulance to one of the specialist facilities. And then you can also work as a children's nurse in a CAMS inpatient or outpatient facility as well. The opportunities within paediatric nursing are so huge. It's not what it's made out to be by Arizona Robbins in Grey's Anatomy, but they are right in the sense that these are the smallest humans in the world. You know, if you picture a 21-week-old child that is like around the size of your hand, and you can be working with organs within that human, like observing surgeries, like this is nursing at its very smallest scale, right up until adolescence. So it's a very holistic field. Sort of every specialty within pediatrics work together to support the patient, and also the patient comes with parents or caregivers or siblings. So it's a very holistic approach. Next slide, please. The advantages are, this list is not exhaustive. As I was writing down the advantages, I had to limit myself a bit, because I mean, obviously we all love our fields, that's why we're doing it. But I could write a 10,000 word essay on everything I love about children's nursing, starting off with it is incredibly rewarding. And the children that you meet are so inspirational. If you think they're in such a scary environment, whether they're there for a RSV virus or they're there for major surgery or cancer treatment, whatever they're in hospital for is terrifying for them, because they might not understand why they're there, yet they're still running up and down the corridors, they're happy, they're playing with toys, they're going through some of the hardest things imaginable, but sometimes it just doesn't matter, and they have a smile on their face and they come out with silly, quirky remarks, and it's just a really wonderful environment to be in. And you get the continuity of care when you work in some fields that both inpatient and outpatient, where you may have patients that come to you frequently or patients that you treat on a regular basis. You might see them from when they're first born up until when they're going off to university or going to their prom, finishing their GCSEs. You get to watch them grow up, and it's kind of like being a part of their family, and seeing children recover or get stepped down from care from them being very ill is just such a wonderful feeling, and seeing their family and supporting their family through that. And you get to build those relationships with the families, and you can be that pillar of support when they need it most. I'm not someone who has children, but I know from my parents and from what I've seen in work that having a poorly child is unimaginable pain. It's horrific for the child, but as a parent to feel so helpless. And we get to be the person that can help the child, but in a sense, help the entire family. And and we can be that sort of beacon of hope. Obviously, on the flip side of that, you're seeing really poorly children, and not all of them will survive, as with the other fields, especially in sort of the acute care setting. You will lose patients, which can be really challenging, and you can encounter patients who have been victims of abuse and neglect, and sometimes the resources aren't there to stop them going back into that environment, which is really, really horrible. But there are lots of cases that you can read up on if you feel able to, but it can be really upsetting, where children are returned to negative care environments because there isn't enough valid evidence to remove them from that situation. So sometimes you do have to return a child to a knowingly damaging environment, which for me is something that is really, really challenging. You see families getting pushed to sort of extremes. So you have to be quite mentally strong to do the field, but this is something that to a certain level you do develop with experience, and every hospital that I've worked in do have some sort of service to support their staff members through challenging times like this. The other thing, the more academic side that can be a disadvantage, is it is so hard to reference, especially towards like the pathophysiology, like disease processes and pharmacology, because a lot of these case studies will be written through doing clinical trials and doing medication trials, and there are a lot of ethics around doing medication trials and treatment trials, and the idea of informed consent. When the patient is under 18, there is quite an ethical dilemma, so it can make referencing really hard. I learned that the hard way by trying to pick quite a niche topic for an assignment last year, and referencing was not that easy, so that is something to bear in mind, but definitely not something to deter you from the field, because you will find options, and that's why it's important to go into research. Next slide, please. So the common modules are similar to the other fields really, except that you do, so the anatomy obviously of an adult is different to a child, and so on and so forth. The diseases that you might see will be slightly different. And with pharmacology, in pediatrics, everything is based off weight. So a simple drug calculation for, say, paracetamol, normally for an adult, you give them 2 paracetamol. For a child, you have to divide the amount by the weight and then times it by the dosage, and it's easy once you get your head around it, but learning to basically constantly be using a calculator is not something that you really think that you'll be doing as a nurse. But in children's nursing, you every medication that you do is checked on a calculator, then checked by another nurse, and then if it's a controlled drug, it's also checked by a third nurse, because the last thing that you want to do is give a poorly child too much or too little of a medication that they need. And then the sort of care coordination, developing practice is the same as the other fields, but with a more child-focused approach. And in terms of the placements, you have your general medicine and general surgery like you do with adults, but obviously with children. On these placements, you'll see a range of things. They're the wards where most patients will be admitted to, unless they're in a specialty such as neurosurgery, gastro-respiratory. But if you go to a district general hospital, it will be general medical and general surgery will be sort of like the only wards. Then you also have my favorite area, which is paediatric intensive care, high dependency and cardiac intensive care. You then have your theatre placements where you might do day case theatre, inpatient theatre, being a scrub nurse, and you get to witness some really cool things. The neonatal intensive care unit, and then the sort of step down from that, which is the special care baby unit, which is where the special care baby unit is where the children will go that have sort of, we use the term graduated from the neonatal unit, but not quite well enough to go home, or children that are born at term, so they're not premature, but they may have a few complications and just need to be kept in for a bit. They'll go to sort of the special care baby unit. As I mentioned, there will be specialties as well, and they will be both inpatient and outpatient specialties. There's the community health visiting, and it's called something different in every hospital, but the MAU or the EDU, which is where if you get admitted through A&E or through your GP, you'll go to one of these units before they take you up to a ward, or if the patient just needs like some IVs or is not necessarily going to be staying in, then they'll go to those units. Next slide, please. This list is of what sort of careers you can have. There are so many. As I kept thinking of more when I was writing them down. There is so much that you can do with a nursing degree of any type. But as a paediatric nurse, some of the things you could do is inpatient nursing, be that in any specialty, health visiting, community nursing, ICU, and in emergency department. You can be a clinical nurse specialist. This doesn't really require an extra degree like an advanced nurse practitioner, but it's where you would take sort of like a band 6 position as, like, say, a renal nurse or a urology nurse or a neuro nurse. You can go into lecturing at uni. You can do a master's to be an advanced nurse practitioner, and you can specialize within that as well. So you can do a master's in critical care advanced nursing practice, or renal advanced. You can specialize right down to the tiniest of things. You can also do humanitarian and disaster relief work. You can do that both paid and optional posts, like volunteering posts through the Red Cross. You can go into being like a charge nurse and taking a more managerial role. Then we also have respite, palliative care, hospice nursing, and end-of-life nursing, which can be both in the hospital, in the community, and in hospices or respite centres. Scrub nursing, which is in the theatre, and then school nursing as well, in secondary school, primary schools, schools for children with special needs, and all of that. Any school you can get a nurse.
That's great. Thank you ever so much to everybody there. I think we all agreed that despite all the sort of individual research and points of view we've brought today, that the field of nursing that is correct for you as an individual is the one that resonates most with you. If you have an instinct, trust that instinct. If you're not sure, maybe give it a go anyway. You can always transfer at most universities. But if there's one that sticks out to you, maybe you can't justify it in your head exactly, but if it feels right, definitely go with that instinct. Here are some resources. I put the slide at the end as well, so you can see this before you leave. These are just sort of some extra bits of information. You can go and visit these websites. They might give you a little bit more detail. So thank you all for listening so far. We are going to now host a very short Q&A. We've had two questions come through Instagram, so I thought we'd very, very briefly explore those. But then please, at this moment, put any questions you have into the chat box so we can have a look at those as we get to it. So the first question, I think, from Instagram was, how did each of you decide to study nursing? We'll just go through one sentence each. We'll try and keep it brief because I know time is running out. So I got into nursing by taking up a phlebotomy job during the COVID pandemic. I realised I wanted to continue in healthcare and I wanted to be very much patient facing. So nursing seemed like the right option and the next step from there.
One sentence is hard. So for me, I was always a bit split over whether or not I wanted to do nursing. I have done an awful lot of campaigning to improve children's mental health services. I've done a lot of campaigning to improve mental health services in general. I've been very involved in mental health charities. And I actually I applied when I was 18 and I got my place, and then I turned it down because I was like, I got scared and I ran away. And then 3.5 years later, I was still sat there going, I want to do it. I want to do it. And it was still in the back of my mind, like constantly in my back of my mind, like, but I could do it. And in the end, I said to myself, I've just got to go for it. If it works out, that doubt will go. And if it doesn't, at least I'll know. Like, I've wanted to do it for years upon years upon years. And I had the place to do it and I left it, and then I still wanted to do it. So I ended up just going for it.
I basically was in a position, thanks to the MenCap campaign's champion training, that I was like 17. I was like, you know what, I'm in a position where I could make changes to how the future of healthcare people with learning disabilities looks, and I feel like I'd be silly if I didn't take that chance.
I always wanted to join the army. When I was 16, I think, I was in hospital and I was looked after by one specific nurse who was just amazing. And the first day she looked after me, I was like, I want to be her. I want to do that. At the time, it was completely not feasible. But 5 years later, I'm on my way to not being her, but being what she represented to me, giving me hope, giving me positivity, and caring for people when they really need it. So that's why I went into children's nursing.
Excellent. So the second question that I think Freya is going to answer for us is, can you study more than one field of nursing at one time? Sorry, if you just go back one slide, sorry. Thank you so much.
With this question, there's yes and no. To do the bachelor's degree, which is the 3-year Bachelor's of Science degree, which will be in either children's nursing, adult nursing, mental health nursing, or learning disability nursing. That is a 3-year degree where you study that field. You may have the opportunity to switch if you're not enjoying your field. It depends on the university, and also within your university what the UCAS criteria is for each field, because if for one of the fields it's slightly higher and you didn't meet that and you want to change that field, there may be it's a bit of a grey area. It's based on university discretion, but in terms of studying multiple fields at the same time, some universities do offer a 4-year degree, which is a master's degree, but it's you can do it straight from A-levels or straight from an access course. You don't need to have a bachelor's degree first. And that is a 4-year degree, and you can do child and adult, so be dual trained, child and mental health, adult and mental health, learning disability and child. They do a various different combinations, but yeah, that is 4 years and you will be dual trained in 2 fields.
You can also do some dual training, and I only know this because I almost applied for it, with other specialties. I know about 3 unis that offer it, and they do learning disability and social work, but once again it's a 4-year master's.
That's really helpful. Thank you ever so much. So we've got a few questions in the chat box. The first one is, are there specific degrees you need to do these 4 types of nursing? So I think today we have explored the 4 fields, and each of us are on a degree. So we have described the degrees that would qualify you as a nurse. There are other routes into nursing, nursing apprentices and that sort of thing. That is definitely something that is on the rise. People who are doing degree apprenticeships, they're working in hospitals and they are doing theory on the side, and they are qualifying in a less sort of traditional university setting. Unfortunately, we don't have anyone who has used that route here today, but if that's something you'd like some more information on, then that's definitely something we can consider for the future. So just to reiterate that the fields we have studied today are all related to a Bachelor of Science degree, which would qualify you as a nurse. So I hope that makes sense.
The only slight difference with the nursing apprenticeship, because this was something that I looked into, for some people, I know some people on the course that are doing a nurse apprenticeship, and it is the right thing for them. And that's what you've got to think. You've got to think, is it right for you? But for me, I kind of like Fleur, had always envisioned myself living in Australia or traveling around with nursing. A bachelor's or a master's degree is like internationally recognized, whereas at the minute the nursing apprenticeship isn't nationally recognized. That's not to say it won't be in the future, but that is something to bear in mind. If you're not planning the traditional degree route, have a look where in the country, where in the world that is recognized, if traveling is something that you're interested in.
That's really great. Thank you, Freya. The next question is, how long does it take to move from each band? Would someone like to answer that one? Fleur?
Okay, so the reason I want to pick up on this one is because it literally varies from whatever job you go into. So learning disabilities, it's really, really common to see a really fast progression rate. So one really cool example is actually a friend of mine, Amy Turton. I don't know why I've said her full name. You don't need to know that. She's just really cool. She came out of her nursing degree in 2020, I think. And between then and now, so that's just under 2 years of her being a qualified nurse, she's gone from a band 5 to a band 8A, which is stupidly high. Her job is really, really intense, really, really demanding, but it really suits her down to the ground what she's doing. And you don't have to go up the bands throughout your career. You can literally stay as a band 5, top end band 5 nurse for the entirety of your degree, like not your degree, I keep on going to say that, throughout the entirety of your profession. It just depends on what sort of things you want to see and do, and who you want to work with, where you want to work, all that sort of stuff. So yeah, it literally just depends.
Thank you so much. That's great. Next question is, how competitive is it to get into nursing? Anybody like to take that?
I think that hugely varies depending on the field, depending on the uni. So we were actually discussing this earlier. Some unis have very small cohorts. So I think at my uni, the learning dis is like 10, the children's is like 15, the mental health's like 25, 30-ish, and the adults like 100. But then I know Fleur mentioned that the mental health in hers is 60, the children's is more, the adults like 400. And I think if you want to go to uni that's near, like, is like specialist in summer or has like smaller cohorts, it can be more competitive than if you went to a uni that's got a cohort of like 60 or like 70 or 80. I'm talking about mental health here because you can get like 10, 15 all the way to like 100. And if there's only 10 people getting in rather 100, it can be more specialty. It can be more difficult, but it's not just down to the cohort size, it's also down to how popular the university is, where it's based, where its placements are. I know that different universities have different criteria. Also, when you go to nursing, you quite often have an interview on top of just your application, which can hugely vary on how they do it. I've had one uni do a complete this online questionnaire form interview. I've had phone calls, I've had in person, I've had group interviews. And I think that can also hugely change how hard it is to get in, because you might be incredible at group interviews, but just on a telephone call, in-person group interviews good at, but a telephone call not so good at. And that can make it harder or more easy. I think it's very much competitiveness varies hugely, and also how easy it is to get in varies depending on what your specialty is, what you want to achieve, and how you're doing it.
It's important to note as well that just because it's competitive doesn't mean it's not possible. It's down to you as an individual. We use my story as an example. I left school when I was 15. I sat my GCSEs, just about scraped pass, but hadn't been to school for about 2 years. Didn't sit my A levels, was out of school for about 4 years, did an access course, and I applied to the uni that I'm currently going to, which is the top university in the country for the degree that I'm doing, and they offer 25 spaces. I applied on a long shot with no anticipation that I would ever get in, because of what I've just told you. I had no A levels. I left school at 15, but I had other aspects that added to my personal statement in ways that other people's didn't. And I'm now a second year at that uni. So it is entirely possible, no matter how competitive it is. It's about what you can offer and not necessarily just the academic side.
My advice would be, if in doubt, definitely apply. You've got nothing to lose. The next question is, can you work as a healthcare assistant alongside your nursing degree? I think the short answer is yes. I think we all work alongside our nursing degrees. There are various sort of ways you can do this. You can do this in the community, or you can do this as a healthcare support worker in the hospital. But that's definitely something that happens. Nursing is challenging. It's a lot of time. It is a lot of hard work. So I wouldn't advise doing too much work if possible, but times are hard, education is expensive, so yes, you can work as a healthcare assistant alongside studying. And
I'd also mention there, when I first got my bank healthcare role, I was on a Monday to Friday placement, and I was working every single weekend, and it is too much. You cannot do 7 days a week between your placement and banking. You have to give yourself breaks. Like, we all want the money, we all want the job. I know a lot of nursing students like having a car because placements can be quite far and there's cost to running that. But make sure you put your own well-being and mental health first, because it is so easy to, especially with bank, it's so easy to be like, yeah, I can do that. And then you'll become so drained and burn yourself out so quick if you don't balance it carefully against how much time you're spending in placement. Your placement is a 40-hour work week majority of the time. Working on top of that, like, I've done 80-hour weeks. I wouldn't recommend them. You're not going to perform well at work. You're also not going to perform well at placement. You're not going to learn as much because you will just be burnt out.
Great. Absolutely. I completely agree with that. Another question, I think, for you, Neve, do mental health nurses work alongside psychologists?
We do. I know quite a few psychologists. Depending on where and what, depends on how much work you do with them. I know where I work, we have a psychologist in the unit, and we see them all the time because in the unit. I know at the hospital I'm at, for my placements, quite often they're based across the entire hospital, so you don't necessarily see them as much, but they're in and out and you get to know them quite well. And I know in community there's psychologists based within the community teams. Psychologists work in a very similar but a very different way to mental health nurses, in the fact that mental health nurses very much try and support their patient through it, where psychologists will quite often look more so at techniques and therapy types and psychiatrists I know get into the bottom of why you react to stuff the way you do. Quite often you will meet your psychologist when a patient has just had a session and they wrap it up. But obviously, while they are incredible and they make sure they support that patient, if something difficult has come up in that session, quite often that then can lead to like it being managed between people outside of that session. It's hugely varied. I love psychologists. I also know people that work bank while training to be a psychologist. And yeah, you work alongside them quite a lot. You get to know them quite well. How much you see them varies depending on the patients that you have at that time on your ward, what you're doing, and how many psychologists there is and to the unit.
That's great, thank you. I am quite aware of the time. I'm sure people have places to be. We have just a few more questions, but do stay on if you can. We can get you your certificates of attendance. Rachel asked, does NHS offer nursing apprenticeship? Short answer is yes, absolutely. I've not actually heard of any private companies offering nursing apprenticeships, but that's absolutely something NHS offers. If that's something you want to know more about, send us an email and we can get a webinar up and running about that. We can get some apprenticeship speakers in, we can write some blogs on it. So do let us know if that's something you want to hear more about. The final question is, what's something you would look for in a personal statement for mental health nursing? Maybe just a brief one, Neve, because I know we've got a MDT webinar and that coming up.
Yes, and I talk too much. I think there's 2 points I'm going to make here. One is that you have the knowledge of actually this is what it is, this is how what you come up across. You're working with patients from all backgrounds. How would you feel about that? I know this because I got asked a question once because I didn't cover it in my personal statement in an interview of how would I feel with working with someone who's had a psychotic break and murdered someone, because that can happen and then not well, and it's not necessarily them acting it. But obviously put that in a way that's not like I do this in this situation, but that you're very much aware of like it can be a hard job. And 2, that you have an interest in mental health, like a genuine interest in mental health. That's going to sound really silly, but I know people that have been like, well, I want to be a nurse in that field, but they have never done anything in mental health or showed any interest in mental health. Show you have an interest in mental health.
Absolutely. And I think we're going to come on to something that's going to be quite important for that in terms of attendance. So that's great. Thank you ever so much, everybody, for that. So we are just going to move on to the final few sort of pieces of admin, really. Thank you ever so much for listening. We're really grateful that you've come and you've engaged. It really shows us that this is something worthwhile and that it really inspires us to do some more in the future. We're going to get you your certificates of attendance now. That might be something you could include in your personal statement for mental health nursing. You know, you have engaged with current nurses and current healthcare, so perhaps that's something that might help bolster your personal statement.
If you are a current healthcare student, or if you're not now but are going to apply, keep hold of your certificate, because you have an online portfolio. Each uni's something slightly different, which you put your placement stuff on, but there's also a CPD page or continuing professional development, and you can just add on there all the certificates of anything you do that is remotely related to healthcare, and when you're applying for jobs they'll look at things like that, so it's really helpful to have.
That's great. So the final few slides, please, Neve. Again, just a reminder, reach out to us on social media. If there's things you want to see, let us know and we'll do our best to provide that for you. Please leave us a review on Google. We want to improve. We want to know what went well. We want other people to hear about what we're doing and raise awareness, and Google is a wonderful tool for that. So please scan this QR code. You should be taken straight to the webpage and tell us how it went. That would be great. Thank you. And then finally, the slide going to change. Lovely. So finally, the feedback form. So this is really important. So if you scan this QR code, you can tell us how we've done today. The URL is there in case you're having trouble scanning it. Tell us how we did today. Tell us what went well, what didn't go well, what would you like to see in the future. And on completion of that feedback form, you will receive your all-important certificate of attendance. So we'll leave that up there for a little bit. After that, I think we'll put the resources back on the screen so you can have a look at those. Any questions, we will wait here for a few more minutes in case we can help you with those. But thank you ever so much for coming. It's been an absolute pleasure for us all, and we hope to see you again and create some more content for you.
Thanks, everyone. I hope you all enjoyed that.
I'm going to stop the recording now.